Hi, everyone. I am Sonia. I'm one of the founders of Mettle Health, and today I'm having a mini Mettle moment with Chris Adrian, one of our counselors. Chris, can you introduce us to yourself?
Hi, everybody. I'm Chris Adrian. I'm a pediatric palliative care physician, and that's mostly what I do. I came to palliative care by way of oncology. I was a pediatric oncologist for a little while. Worked in bone marrow transplant, but also trained as a hospital chaplain, and that's kind of the other piece of what brought me to palliative care was loving the work I did as a chaplain and hoping there might be a place somewhere to do something that approximated that work as a physician, and palliative care was it. What else do I do? I'm a writer. I write fiction and nonfiction. And I am a psychedelic facilitator, trained as a facilitator in a underground community, but then also in more conventional settings. And I help out as a facilitator on some psychedelic studies. Research studies.
Wow. So just a few buckets. I find that your inclusion of pastoral care in your work is very unique. I don't know any other oncologist who has that combination. I'm wondering if you can talk about what made you want to have both.
Yeah, it started with going to divinity school, which I sort of tricked myself into going, I think, because I think the reason that what I got out of it was not what I was expecting. And if anyone had told me this is what's going to happen to you there, or this is what you're committing to by taking this path, I would have run away at high speed. So I went to divinity school thinking that it was going to be mostly an academic pursuit, that I was going to learn to be a theologian, and that was going to be very important for the kind of writing I wanted to do. And I got to divinity school, and they figured it out. I figured it out real quickly. I was not cut from the right cloth to be a theologian.
The cleric cloth.
But the other piece of why I wanted to go was the sort of vague idea that, oh, well, I'll learn something there that will help me take better care of my patients, because I went after I had finished my peds residency. That's the part that really kind of stuck, and slowly over many years, much longer than it should have taken, really longer than it took for my peers. I figured out what that other piece was, and I think that what it was really like figuring out what it was about medical and existential complexity. I knew I knew by that point that I wanted to be a pediatric oncologist, and that I liked the medical part of that, how I like being part of a team that took care of those kids when they got very, very sick as part of their in the course of their treatment. But that there was something that I was drawn to about being in the mix of some really serious existential questions. But I don't know that I ever knew how to answer, either for myself or for the people I was with, or for the families I was trying to take care of. I think there was something about just not knowing, well, how do people do this? How do they go on when in the face of some really extraordinary suffering and heartbreak? And that, I think that didn't quite know it when I started. That wasn't the piece that I went looking for. But once I was there in the training, I was like, oh, I think this is what pastoral care actually is able to get at and support in ways that nobody ever really told me about, or made space for in conventional medical training. And I think that the other thing that I would have been like I would have run away from if anyone had told me it's what was waiting in those training forums, was just the idea of really learning to answer those questions for yourself or take care of yourself around them. This idea that again was really totally foreign to me, and quite scary in many ways, coming out of regular medical training, that if I wanted to be with other people and their suffering, I really needed to acknowledge my own suffering as just as a regular old human being, and also my own suffering as someone who had once been a child, and once been a child who went through some extraordinary stuff, who now found herself in a setting where I was surrounded by children going through extraordinary things and children who are suffering. So that piece, which wasn't so much like, well, come and spend time with us, meaning the pastoral care folks. It wasn't so much that they were saying, well, come and spend time with us and we'll sort this out and we will teach you. You'll learn to do this thing in the same way that you learned how to do a bone marrow biopsy or a lumbar puncture. What wasn't like that at all. It was more come into this sort of vague, painful ambiguity that acknowledges how totally mixed everyone's experience of life is. We will help you. We will help you foster the native talent that every human being has to be in this stuff together. So anyway, that was why I didn't, and again, I didn't know why I was doing it until it was too late to turn back, which is good.
Well, to me, it encompasses two parts that are both very important, is like the medical care of tending to our body and making sure that that part is right, but then also being able to speak to the other side, like you said, of mystery and ambiguity and not knowing and living in a space where you don't know the outcomes, seems really important. And I feel like we may have already answered this question just with you answering that last question, but what is it you feel that children that you're caring for and their parents need most when they're living with a serious illness or, facing the end of a child's life?
Yeah, I mean, I think we touched on it a little bit. I think they need a team that can be present for them in the way that we were just describing. Again, they might not, the team might not, and in addition to someone to attend to the medical needs and kind of the technology-based stuff for which there are best practices and standards that are that are regulated and kind of the same, in many ways the same across the board in any pediatric hospital. On top of that, I think that, and this is where I think spaces like Mettle or other interdisciplinary and sometimes transdisciplinary palliative care teams come in. So I think that I think those children and their parents, they need someone to tell them, especially in the setting of working with the hospital system with a chronic illness. They just need someone to tell them they're not crazy, and that they're not alone. And that maybe, I wonder sometimes if maybe that, like that aspect of you need someone to tell you you're not crazy during the long haul of the illness, and then need someone to reassure them and prove that they're not alone as they come closer to, as a child comes closer to the end of their life and the family starts to navigate end of life and beyond. I think in that chronic course of the illness, when they're trying to navigate a pediatric healthcare system, which might have many fantastic strengths, but still, I think usually is in a pretty dense kind of denial around its lapses and shortcomings. So when parents, when they're just in the course of doing the regular advocacy for their child, they start to reflect back these lapses, and because the system can't acknowledge them, they start to feel at best confused, and at worst really totally gaslit. So I think having a team that can, without pointing fingers, laying blame, or triangulating, can just be with the family and acknowledge, this is really hard, and it's part of the program, and it is emphatically not you. You are doing the best you can, and you're not doing anything anything wrong. So I think that just having a team that can say you're not you're not crazy. You're doing the best you can. You're doing everything. And here's some, and maybe there are some ways where we can be an extra layer of support, or operate as coaches. Sometimes, just being able to pass on or be a conduit for the wisdom of other parents, or being a conduit, or a signpost for something like Courageous Parents Network, which we've talked about at Mettle before, can help meet that particular need. And then, once when they're coming to the end of the child's life, if not their journey as a family, having someone around that can reassure them that they're not alone, that the system and the people in the system haven't abandoned them, even though some parts or people in that system might be leaning away out of grief or out of fear or for any number of reasons. And I think they need someone to reassure them that they won't be alone after the child dies either. That there's a team that will stay, that this is what a peds palliative team does, and I think it's something that distinguishes them from other medical teams, is that it's as a matter of course, it's not a special gesture to stay in touch after the child dies. It's part of, it's just part of what we part of what we do. So making sure they know they have us if they have nobody else, and then also sort of maybe starting to gently open up or suggest to them, without forcing it on them or being making or having it feel intrusive or put upon them. Just making space or starting to make space for this notion that that there is a community out there still for them. There's a community of the club no one wants to be in, but it is nevertheless a community that's of other parents, other families that have been transformed in the same way that they have. And who learn together, I think, day by day, year by year, how to honor their losses without being permanently destroyed by them. That's, I think, again, maybe that comes back to the first thing we were talking about, or what is that? What is, like, how does anybody do this? And I think we all, none of us want to know, but we kind of all know, or we all learn in our ways, and that's one of the things that feels particularly special about Mettle to me is that it's a space that really acknowledges that what's being brought on the counselor side isn't, is just it's just part of being a human being with somebody else, or trying to be real with them. And yet it's also not, it is that, and it's also not just sitting down at a park bench with Forrest Gump. Not that that isn't its own special, delightful thing. That we are trained, we are all coming out of a lot of experience in different disciplines, and yet but it never, whatever it is, it isn't, I'm here to tell you how to be. It's to really share something that we're both caught up in, even if what you're caught up in the moment is so much harder than what I'm caught up in the moment. That really feels like the bottom line of it. And that feels nice to me. It feels like a gesture, at least, even though I don't know that we don't have it worked out. I don't know if anyone's ever going to work it out, to reduce the sum total of crazy makingness
Hmm.
in the system.
Yeah, I don't know if we're the ones to do it. If someone else though can work on it and tell us how, I'm fine with that one. Thank you so much, Chris, for sharing a bit about yourself and your work. We really appreciate it.
Thank you.